Hello, I'm Bruce Fabrizio, inventor of Simple Green. Are you looking for a powerful cleaner that removes tough grease and grime from nearly any surface? Simple Green gets the job done safely. With hundreds of uses around your home, yard, office, or garage, this versatile cleaner is your secret weapon for spring cleaning. In fact, I'm so certain you'll love Simple Green that if you aren't 100% satisfied, I'll refund your money. Try Simple Green today.
Hey there, and welcome to the Think Fitness Life podcast. We're fueled by the incredible clients who inspire us every day, allowing us to elevate their health and fitness journeys. On this show, you'll gain valuable insights from top professionals, hear inspiring transformation stories, and discover the knowledge and motivation to create your own best life. Let's dive in. As someone who has continuously used therapy as a way to heal and elevate my personal performance, I know wholeheartedly that you cannot always read the label when you're in the jar. And that's why it's so helpful to have a professional in your corner to talk to. This podcast is sponsored by BetterHelp to provide our listeners with the opportunity to work with a licensed therapist from the comfort of your own home. Receive 10% off your first month when you sign up by going to betterhelp.com/TFL. That's betterhelp.com/T as in think, F as in fitness, L as in life. And remember, you're not alone. There are people out there who can help.
Welcome back to the Think Fitness Life podcast. We talk about exercise, nutrition, and overall health. And one big thing that's really stemmed up nowadays, and I've read about it for a bit and seen some stuff on the Netflix. There's a new show about it now, and it's really talking about the world of fertility and how our hormones over the years are starting to decline because of the lifestyle we've started to choose, the things we're eating, the things we're putting into our body, but mainly, and I've heard this from my own friends and people that I know, is fertility issues. And I think that's a big thing. And we've never covered this on this podcast at all because I'm not really an expert in it. And I always thought most people would not really want to take my advice, but that's going to change today, but it's not my advice. We have Dr. Gabriela Rosa on, who is a fertility specialist. She knows her stuff. She's got a master's in reproductive medicine and human genetics, which we're going to deep dive into that, master's in public health, and is working on her doctorate. She knows her stuff. Welcome onto the show, and let's dive into everything that you're passionate about, because when I went to your website, it is really about how do you drive optimal health for a family, really? Because when it comes to fertility, it's how do we help people who are struggling get over that hump or realize that they can change the trajectory?
Yeah, absolutely. Thank you so much for having me. I think this is such an important conversation. And one of the things that I often hear, and it's a societal conditioning to speak, that fertility is a woman's issue, that miscarriages are a woman's issue. And the reality is that fertility is a 50-50 equation, where both partners need to put 100% of themselves into it. A woman, as good as we are, we still can't reproduce asexually. It takes that male factor component to be able to get the results that obviously a couple wants, which is a healthy baby. And when things are straightforward, which, mind you, 96.3% of people will conceive within 2 years of trying. They will have a baby and all will be well. And most of the time, when things are just as straightforward as they quote unquote should be, within 3 conception attempts, most couples are pregnant, having babies. And that's why we hear a lot the drunken one-night stand where somebody has basically went, oops, I'm pregnant. Or somebody has basically just stopped the contraceptive pill and got pregnant. And usually that happens much, much earlier on. A question that a lot of people have these days, because it's been on the news a lot, which is fertility is declining and the population is at risk. And there is some truth to that. But what's really interesting is that the fertility rates that we hear about are people who basically, I think it's a win that we're having less teen pregnancies, but that's actually what's showing up in declined fertility rates and an aging population. More women than ever are having babies in their 40s. And it's not to say that age doesn't play a role, and it plays a role for both the man and the woman. And I'll talk more about that in a moment. But I think that we focus a lot on the fact that most people conceive easily without trying. And when it's not easy, then that it's going to be work ahead, because for the 4% of the population who don't get pregnant easily or who experience reproductive difficulties, what ends up happening is that they end up getting treated in the same way as the people who have never had a problem to begin with, which, if you imagine, when you don't have a problem and it's straightforward, very little is going to be done for you because nothing needs to be done for you. But when you do struggle and you are having difficulty, when very little is done for you in the same way that it would happen in the general population, I think that's one of the biggest issues that couples struggling to conceive or keep a healthy pregnancy to term face, especially when the pathway in this day and age in terms of healthcare, it is you go to your GP, you self-report that you've been trying for a year, there and then you get a diagnosis of infertility. It's going to, if you're lucky, your doctor is going to ask for some tests. It's going to be checking that your fallopian tubes are clear, checking that your uterus can house a pregnancy, checking that you're ovulating, and if the male partner was in that consultation, giving a referral for a semen analysis. Most of the time in those early stages, women go to consultations on their own and men don't get tested unless they specifically request to be tested. And again, self-report with the same issues. Now, that's all that there needs to be done for a doctor then to say, we've done all the tests and everything is normal. Now, underneath that, there is a world of what could actually be going wrong. And most couples really never get the proper care to understand that. And then they basically just get told, don't worry, IVF is going to fix it. Let's just go down that path. And we know from population level data that 80% plus of IVF cycles that get started do not yield a live birth. So just going through IVF doesn't guarantee a baby.
It's always fascinating because I always think that, well, I've always thought, because this is going to sound ignorant, that it's always been a thing that infertility is a female issue. When in reality, as I start to read more and more now, you said it's both. And I think that kind of thought needs to be changed. It's not just on the female, especially now where things are impacting the male fertility even more. We're going to go into, but even the stuff we put on our skin for males are doing, I don't think a lot of guys really think about that. And they just think, oh, it's got to be on the female side, but it's not.
It absolutely isn't. And it's really interesting because there's some very basic things that we just assume are just the norm. And I know this is a fitness podcast. I imagine that most of the men listening to this are going to be focused on their fitness. They're going to be focused on how they look and their exercise and all of that. And that is fantastic, because just yesterday, I do a lot of patient education on Instagram, Gabriela Rosa Fertility. And yesterday I posted something that most people do not realize. There's a lot of focus on if your BMI is high. Now, BMI, body mass index, for men who train in particular, it's useless.
Yeah.
And because really, you're going to have a whole lot more muscle. You're not going to benchmark against the population well. And you can get a guy who is obese and 100 kilos and a guy who's 100 kilos of muscle, and they will have the same overweight BMI. And we know that those measures aren't very accurate. But what is accurate is waist circumference. And a lot of times what we don't quite realize is how metabolically active visceral fat actually is. But there's a lot to be said for metabolic health and fertility going hand in hand. And so yesterday, with this particular piece of research that I was communicating about, there was an interesting study. It's quite recent, and it showed that every 5 centimeter increase in a man's girth decreases IVF live birth rate by 9%. That was when it was adjusted for BMI, adjusted for age, adjusted for female factors. But you can imagine, when was the last time that you went to your doctor and they said, listen, you need to take care of your waistline if you want to be more fertile? Certainly, exactly. It just never happened. And it doesn't happen in a fertility clinic either. And yet it is scientifically evidence-based knowledge and information that, and this is the other issue that happens a lot, is that from the science to translation of that science to actually actionable guidelines, it takes up to 17 years on average for you to actually a study be published and you actually be receiving those guideline changes within the kind of healthcare system structure. It's a huge delay. Now, a person who's trying, or a couple who's trying to conceive today, they don't have 17 years for that information to become public knowledge and understood and acted upon. And it almost becomes, the onus becomes on the person experiencing the difficulty to fix and diagnose and solve their own problem, you see. And that is a really difficult place to be, because what you're hearing today from your doctor is based on the guidelines that were set sometimes 10, 20 years ago. The World Health Organization just decreased the benchmark of what is normal sperm 3 times in the last 3 decades. 3 times. What we've seen across the population is that in the last 60 years, male sperm count has decreased by 60%. And what is normal today is not optimal. It's not actually what is, quote unquote, truly normal. And what ends up happening is that here we are acting upon information, thinking that you can just go with the status quo if you're having difficulty and it's going to be okay. In the general population, that is true. If you're younger, usually that's true. There will be lots of people who drink, smoke, do drugs, shoot up heroin, and end up with babies. And society will even call them healthy because they have one head, two arms, 2 legs, all of that. And that is what we see as healthy. But are we truly focusing and optimizing for the things when it comes to fertility and the long-term quality of life of not only the individuals, but the child as well? There was another super interesting study showed that when we have impacted sperm parameters, that actually decreases men's lifespan by about 5 to 10 years. Proxy for longevity and quality of health is male fertility, and we're not talking about that enough. We're not understanding that enough. I think that those are really important things to be clear
especially
on.
when they're dropping the norms. How can you, for me, you can't drop norms and expect the people to be okay with it, because then you're setting up people to fail. You're just saying, hey, we're allowing you to have a new norm. It's not what it used to be. And then people are struggling. Let's talk from a guy perspective. If they're really,
but you see, but this is
go for it.
No, sorry, I didn't mean to talk. No, what I was going to say is that this is what's happening. And if you look at what was classified as obesity 20 years ago, it was really what is now slightly overweight. What ends up happening across the population is, as a population group starts to look very different from a benchmark that was set, we start to lower the bar. And what happens is that if overweight was 5 kilos 20 years ago, now it's 10 kilos. And as you said, what ends up happening is that the quality of health in the population literally decreases incredibly over time. And what concerns me here, it's not really for this generation or the next generation, but what are we going to see in 5 generations from now? Are we even going to 5 generations from now?
That's the big problem.
These are important questions.
That you don't know what's going to happen, and we start to see a decline. And for me as a coach, and that's why you do what you do, and we this podcast, because the doctors go with what the doctors are told. But then there's great, how do we help humans be humans? Because we don't want to just be told, hey, this is the new normal and you're just less than what it was. I don't accept that. And then the sad part is you have people who accept it And they're, well, if it's a new normal, this is just who I am. And then their expectations when they go to have a family from a guy standpoint, all of a sudden it's, well, that's a lot to deal with psychologically, because if a guy can't do it, what's the point of being a male on this earth if they can't procreate, if that's their end goal? That's a toll on their system. And the biggest thing for me when I was going through grad school, when I read that sperm quality, I believe it's 3 months prior. You want to make sure before you conceive or try to get pregnant, your sperm is from 3 months ago. Similar with egg quality. How many people don't actually know that? Well, I'm going to start eating healthy. We're going to try in 2 weeks. It's no, your metabolic profile and what you did 3+ months ago is really what we need to hone on in. But you also never know when that's going to happen. You always want to be healthy.
Well, and this is you've hit the nail on the head. And actually those numbers, it's really interesting because yes, a sperm cycle is 3 months. By the time it's formed and matured, you will have basically what you're ejaculating today is sperm from 3 months ago. Right. And ultimately, whatever it is that you're doing today, whatever inputs you have, whatever exposures you have today is going to impact your sperm 3 months from now. And what ends up happening here is that if we're starting from a lowered point of count, motility, morphology, increased DNA fragmentation, which incidentally is one of the most important markers that essentially tells us how likely a live birth is. And that test is not even a standard in a semen analysis. You see, you go to your doctor, you ask for a semen analysis, you will get the basic sperm count, motility, and morphology. And sperm DNA fragmentation and semen culture, which is extremely important because there are many silent infections that essentially affect the quality of sperm that often aren't screened for and therefore not picked up and treated. And that will continually negatively impact sperm and increase the risk of infertility, miscarriage, and failed treatments. Whenever I see a woman has gone through IVF, she's collected 20 eggs and with no embryos, that is usually to do with sperm. You see, and most doctors will basically just say, it's a numbers game, just keep trying. Mind you, we have to open a bracket here that the incentives in healthcare these days are not aligned with the patient's best interest. And that is just a reality. About 60% of IVF clinics are private equity owned. And so what private equity wants is profit. Be very clear about that. What they want is the more cycles, the better. If we can have people have 8 cycles, continue treatment and pay more rather than less, that's good for the bottom line. And I'm not being facetious here. It's not about IVF is amazing. It's a wonderful technology. Doctors really care. But when doctors are almost a pawn in this wide healthcare system that has many players who have different interests. Pharma has one interest. If we sell more drugs, we make more profit. If we do more treatment, if we sell more IVF equipment, there are lots of those players within the system who basically, they're there to profit at the end of the day. Yes, there is a big rhetoric about we want to help people and all of that. If you really want to help people, help them understand that they have agency over what it is that they do, how they do it, and that they can actually optimize to transform results as opposed to just not doing any testing, not doing any screening and assessment, believing that if we just treat, we don't have to test, because that's how the healthcare system operates. At the end of the day, it's about cost effectiveness. In the healthcare system, if it's going to cost the same amount to prevent a disease, then it will cost to treat the disease. We are not going to spend dollars on prevention. We will just focus on treatment. But then what ends up being forgotten in that equation, and I've taken cost effectiveness at Harvard. I know very clearly how this works. If we're going to not necessarily have to, because not everybody will develop. Risk exists. And the way that risk works is that if there is an increased risk of something, you don't know who actually is going to be affected until they have been. you assume that it's not gonna happen to you, or you prepare that of it happening to you. But for the most part, what ends up happening is exactly that. It's, well, if we're going to treat anyway, why test? If we're going to treat anyway, why prevent? And of course, my paradigm is very different, because even though I'm heavily trained in science, I am also a naturopathic doctor. And so about focusing on how the body, it's amazing how when you remove the obstacles to optimum health and you give the body the support and the foundation that it needs, how often it just knows what to do. And sure, sometimes you need to help it along, particularly when the finite time of fertility is so, there is absolutely no extension to fertility with your own eggs unless you decide that you want to go and have donor egg. Basically, you under that kind of situation, you have to make certain values and preferences decisions depending on where you're at. And of course, if I find an infection, I'm going to reach for antibiotics. I'm going to literally recommend that person goes and has antibiotics. We address the gut later. We fix everything else that the antibiotics would have negatively impacted, because ultimately having chlamydia is much more likely to negatively affect your chances of taking home a healthy baby than taking the antibiotics. Or sometimes we might need surgery. If a man has varicose veins on his testicles and it's creating extra heat and it's negatively impacts the ability for his testicles to actually manufacture a healthy sperm, you are much better off going and having that varicose vein essentially removed or treated in some surgical way than to hope that and that your sperm is going to improve. Because sometimes it does, but sometimes it doesn't. And here's what happens. If you're already in a situation where you have impacted sperm, egg quality, whatever it is, it does take 3 months for the sperm to mature and form. But sometimes it can take up to 3 to 4 sperm cycles to see full results, you see. And the things that you are doing today are impacting you 3 months and beyond. And if you are starting behind the 8 ball, as we would say in Australia, basically what's going to end up happening is that we are going to have to do more work, and we're going to have to do that work for a longer period of time. And so a lot of times people think in terms of, okay, but what does that mean? Does it mean that I have to stop drinking, stop doing drugs and do it? It's like, well, only if you want a healthy baby. If you don't, well, then that's okay. And how long do I need to do it for?
Yeah.
As long as as long as it takes for you to actually be holding your baby. Because this is another huge unpredictability of the fertility journey. Just because you get an embryo, you get pregnant, doesn't mean that you're going to deliver a healthy baby. And if that pregnancy is complicated, it doesn't mean that you will deliver a live baby. And so ultimately, those stages, not because I want to scare people, but they are sensitive. Those stages, they require care and, a kind of awareness in going through them that don't get to redo. That's the big takeaway. Ultimately, this is your moment, and that this is your moment now. In 10 years or 20 years from now, you're not going to think about the quote unquote sacrifices that you had to make to be able to overcome infertility, miscarriage, failed treatments. You're just going to know that what you did made a difference to you in one of 2 ways. Well, actually, definitely at least 2 ways. You would have been healthier and you will be holding your baby, or you will know that it wasn't because of something that you did or did not do that it didn't happen. And I think that there is a great amount of peace of mind that comes with that approach, because you can't blame yourself. There is no guilt. Know that you've done the things that you needed to do, that it's a finite period of time. Imagine even if you had to go without drinking, smoking, doing drugs, whatever, for 5 years, 5 years out of a very long life. It's not going to be the end of the world. And I think it's good that you do say
scare tactic, because you kind of want people to be a little afraid of that, because their lifestyle choices, those big ones you said, One of the biggest ones I see for people my age is the drinking. Here's really scare people: alcohol and drinking. Now, if you drink whatever, I really don't, but it will damage mitochondria to the nth degree. It is poison, and I always tell it to my clients, it's going to damage mitochondria across the board. If you're someone trying or know that you want to have a baby and try to get pregnant, to me, that there's no point at all in those months or years that I'd be, hey, I'm really just going to go out and keep drinking or do anything that's going to limit my chances. And I'm a person that is going to count all my cards, because I don't want to look back, you said, and go, well, what if this, what if that? I want to optimize my overall health no matter what. Prior, it's okay, mitochondria, my health. But now as you start getting into talking about building a family with someone, it's you have to optimize your cellular health for the baby. It has nothing to do with what it does with you, but it goes to all about the mitochondrial health of the baby. And I know from the guy's standpoint, I don't give as much mitochondria as the woman does, but still, either side of things, I contribute a little bit. Correct.
But you give the same number of genes. And that really, at the end of the day, that is what matters, because the DNA fragmentation issue, which is damage to your genes, which is in your genes, you're passing all of that on. It was a really fascinating study, 529,000 men. And what it showed is that any level of drinking, any one or more regular drinks per week, increased birth defects in the child by 35%.
Yeah, people better take note on that one. Whew.
And this is population data. And it's amazing how people want to argue with the data. Oh, but it's observational data. And yes, why it's observational data? Because it would be completely unethical for you to randomize a man trying to get pregnant to drinking alcohol in a randomized controlled trial. It's unethical. Nobody's going, no IRB is going to approve that. You see, and ultimately what ends up happening is that we think that, it doesn't matter, it's just one drink. Actually, that's exactly what this research showed, is that just one drink on a regular basis will have that level of effect. And that's what I was saying, is that risk happens in a way that you only know that it affected you once it had. And when the margins are already small for success, you want to address every possible modifiable factor you can, because without doing it, you will end up in a situation where later you will think, if only I had. And I think this is incredibly important. I mean, don't even get me started on smoking. I mean, really don't get me started, because those exposures are absolutely toxic and they imprint in our genes and passed on generations, not only your very next generation, but your child's children, and so on and forth. Ultimately, and if you think about it, with smoking, for example, and paternal smoking has been shown to increase risk of miscarriage, failure through IVF, you name it. Now, one IVF cycle on average costs $20,000. $20,000 per cycle. On average, to have close to an 80% live birth rate, you need 8 cycles of IVF. So wouldn't you want to be optimizing your chances if you really truly did need IVF? I mean, mind you, I did a Harvard study, which was my Harvard thesis for the Fertility Breakthrough program, which is our signature program in the clinic. And what we were able to demonstrate was a 78.8% live birth rate for people who had been infertile on average 4 years, typically had done IVF cycles that didn't work. More than 50% of people had experienced recurrent miscarriage. And we were able to demonstrate a 60% live conception rate amongst people who had basically tried everything, quote unquote, and nothing had worked, via natural conception, by ensuring that we are addressing all of these issues and really properly diagnosing what's going on. Because you see, here's the big problem that I think a lot of people don't realize. And I think men can really understand this. When was the last time you fixed a problem you didn't know you had? It's one of those really, really interesting things that I have the best analogy. My bathroom, my toilet leaked once. I actually thought it was my kids, not getting the aim. I was thinking, hey, the kids come here. I made them clean it about 3 times. And then I'm, hang on a second. And then, it wasn't me, all of that. But I'm not hearing this. You guys are pinging all over the place. You come and clean it. So by the 3rd or 4th time of major complaining, and just absolute uproar. Okay, let me check this out. I realized that it was actually clear. It wasn't pee. It didn't smell pee. Okay, probably the toilet's leaking. So I called in a plumber. The plumber comes in, removes the toilet, reseals it, does all the things, says, look, in 24 hours, you can use it again. Okay, great. Wonderful. We had this problem in another bathroom in the house. I thought, okay, it's the same thing. Let's just get it sorted. Or that happened. And 24 hours later, we start using the toilet again and it's leaking again. And I'm thinking, okay, that's not great. 3 visits later, you clearly don't know what the problem is. I'm going to have to call another plumber. They go through the same thing. They go outside the house. They go inside. They look everywhere. And then they go, we're going to have to bring a $3,000 machine to be able to assess if it's leaking from the wall. And we're going to have to remove some tiles. I'm okay with the $3,000 machine, but we're not removing tiles. So let's just leave this. And I was going on holidays, and basically I said, look, just leave the toilet off. I'll come back. I'll decide what to do when I'm back. So as I left, there was water there, but I couldn't see things coming from the back of the wall, from the wall itself. I just thought, whatever, let's go on holidays, come back, everything is dry. I think, maybe the problem is fixed miraculously. This is amazing. Go in the shower. Second, I turn around and look to the ground. The ground is bubbling up with water. And I'm like, okay, we have a shower proofing problem, not a toilet leaking problem. And once I realized what the problem was, that I was going to actually need a $30,000 bathroom renovation as opposed to a $3,000 machine. But at least I understood how to fix the problem properly. And for the long term. And if I didn't, what would happen? This thing was going to start leaking on the ceiling. It would have affected the bottom floor. It would have been a disaster. And at the end of the day, the $3,000 machine was never going to fix my problem, you see. And had I not actually diagnosed the problem properly, I would have still be having an issue, probably a much bigger issue down the track. That is exactly what fertility patients experience. You see, there's a really interesting study on both men and women. And what it showed was that for people who had a infertility diagnosis, they had higher all-cause mortality from cancer, diabetes, and cardiovascular disease at the 10-year later mark. And basically, what we can see is that fertility isn't just what you do for having children. It's actually a signal from your body about how you need to take care of your health. And one of the most specific and easy examples to see is a simple diagnosis of insulin resistance. A lot of people who have difficulty conceiving or keeping a healthy pregnancy to term, men and women, have silent insulin resistance. And it's really interesting also because when you go and have your conversation with your doctor about, can you just check my blood sugar levels, and they test your fasting glucose, but don't test your fasting. Well, guess how useless that is? Very, very useless, because your body can produce 5 times more insulin to keep your blood sugar levels at a normal baseline for you to have a beautifully perfect star on the chart blood sugar level, fasting level, and your insulin is working overtime and your pancreas is working overtime to maintain that quote unquote normal. And what happens is that by not understanding what you're dealing with, because you're not actually testing properly, you end up negatively impacting your health. And with insulin resistance being the prime example here, what happens is that you don't know you have it. It then develops into prediabetes. We know from research that once you have a diagnosis of prediabetes, you are going to develop diabetes if nothing changes within 5 to 10 years of the prediabetes diagnosis. And 10 years, according to the research, is the long time. Usually more on average, it's about 5 years. And what happens with insulin resistance early on? Well, because we haven't done a fasting insulin, or because and a fasting insulin anywhere above 10, is going to be a problem. That should be sirens should be off, because metabolically speaking, there's a lot of inflammation that's going on within the system because the body is trying to compensate. And what ends up happening is that after that elevated insulin that is called normal, because again, in the population, these numbers have had to increase because everybody now has, and if everybody's being flagged, that costs the healthcare system, you see. And so we want to decrease costs in the healthcare system. We increase the threshold of flagging to a disease level flag as opposed to a prevention level flag. And when you look at a blood test, you cannot take the lab's reference range as the normal range, because those ranges are increased all the time. And also they are derived from the population of people who have had that blood test. Now, who are the people who go and have blood tests typically? Are the people who we have an inkling or a very big suspicion that they are sicker in some way. So unless you're me, probably you're not going to be sitting there for a 2-hour glucose tolerance test because it's another day in the week. I do that every 6 to 12 months. And it's about really figuring out, okay, where am I at? What do I need to work on? Is there something that I need to know in advance that I really understand what is happening within my body? But most people don't do that. And they basically let that pass. And by the time they actually understand that they have that, whatever, the implantation failure or the lack of ovulation or the poor quality of sperm, because you see insulin resistance, because of the increased inflammation, will increase DNA fragmentation, which also will negatively impact count, motility, morphology. And this is one of those things that it's downstream from something that seems to be simple and can be addressed. I mean, if you're looking at an insulin resistance diagnosis, yes, address your diet. Yes, go and do your zone 2 training 4 days, 4 days a week. Go build some muscle. And within 6 months of you being really consistent with those actions, you will actually reverse that diagnosis. Now, it's more difficult once the disease has already set in and you already have pre-diabetes or you already have a diabetes diagnosis, to reverse that. It's not impossible. It requires a lot more diligence and consistency at a higher level, you see. And those things that they do impact fertility in such a big way, and they just don't get flagged. They just don't get looked at in the way and really given the importance that they need for you to actually have the best possible outcome. And this is what I'm saying in terms of when you go and have blood tests or a semen analysis or whatever it is, look out for the ideal ranges in those results, not the lab reference ranges, because the lab reference ranges will reflect the aging and more unhealthy part of the population, not the healthiest.
And I'm glad you brought that whole metabolic thing up, because that's what I think a lot of people need to understand. It is a big metabolic issue when someone talks about infertility on either side, male or female, that it just doesn't get addressed by doctors. And then my question, I'm sure people go through IVF and they're still metabolically not healthy and it's not successful. How do you expect? I know IVF works it works for good reasons for certain people, 100%. But if you're not going into it with the mindset of, hey, I need to be metabolically healthy, because I'm going to put a growing human and cells into my body that's going to survive off of it. To me, it's just, I'm sure you can. How can people not do this? But in fairness, people don't know. And when we have these conversations with people, it's people look at us,
and they're told
what you do, and you're going to blow this door open for people. And they listen. Oh, I've been missing this bucket and no one told me about fertility, because it's in books that I've read, my wife's read, but most of those people aren't going to pick up those books that we read. And I'm sure you read too, and go through birth control and everything that can affect from the woman's side, and then everything that it can affect from the male side. It's okay. Here's the deal. Hormone optimization has become a big topic nowadays. How to keep levels optimal for overall health is key. Adding in the right supplements can boost overall health. Right now, you can. With Recommend supplements, men formula and women formula pack that punch. Better recovery from workouts, stamina during workouts, increased libido, sexual function, mood, energy. Combine it with their clear and focused nootropic for cognition and brain health, and you have one hell of a routine coming your way. Recommend uses clean, organic, natural supplements combined for these capsules. Take advantage of increasing your health every single day with these two supplements. I've been searching endlessly for supplements to enhance my health, and my supplement cabinet has been filled over times until I sat down with the founder, the creator, the doctor who created these two supplements, and that's all you need. The efficiency of enhancing overall health is the name of the game. And you can get your health enhanced and optimized by using code TFL20 for 20% off when you go to recommend.com and start your health journey today.
Absolutely. And a lot of times, it's also comfortable for us to hear that there's nothing you can do, or, oh, you're okay. It's fine.
And people don't want to hear you got to be healthier, you got to lift weights, you got to work out, you got to eat clean. Ooh, man. It's for me, that'd be how bad do you want to have a kid?
It's
how
a
bad
lot.
do you want to have a baby? To me, I'm going to put everything in my system to optimize my mitochondrial health, because that's the genetic I'm going to pass along. I just don't see how anyone wouldn't want the best.
Absolutely. And again, I think that most people want the best if they don't have to work hard for it. I think that there is an aspect to that. And then there's also an aspect of, who do I believe? And because it's easier to believe your doctor, who will tell you, don't worry about it, it's okay. Unless you really are very desperate, you are going to want to search for other answers. And this is, by the time people come to me, unfortunately, I mean, really what we do should be the very beginning of the fertility journey for many, many people, because we know I've now taken 218,000 people in over 111 countries through my free Fertility Challenge program, which teaches exactly what do you do. It's 14 days. Literally, you go in there and you go, start day one. Now let's break this down in actionable things that actually move the needle. But by the time they come to me, by the time most people come to me, they've already tried for years. They've already had things not work for years. A couple that is always on my mind, they were trying for 14 years. They were 14 years of infertility. They had the first 8 years, they just tried and thought, let's just see what happens. They weren't exactly too focused on it because they were building their careers and life and all of that. But then by the time the 8th year came about, they were, okay, we better get more serious about this. They started treatment and they did 6 IUI cycles, artificial insemination, and then that didn't work. And they just basically didn't really know. It wasn't their area of expertise, even though she was a pharmacist. For her, it was just, okay, well, the doctors are telling me to do this, let's go. But then the next step was IVF. They did 2 IVF cycles and it didn't work. And they then were told, oh, it's your eggs are no good, you need. And I'm thinking, by the time they came to me, they're telling me this, and I'm thinking, you didn't start with old eggs. How is it that this didn't work back then? So anyway, I talked to him and I said, is this the only semen analysis that you have? He goes, I said, okay, has it been low before? He had 2 million sperm and he should have at least 20 million. And I'm thinking, okay, is this a trend? Is this something that, anyway, so he basically turns around to me, he goes, what do you mean my sperm count is low?
Oh, wow.
He had never been told that he had a low sperm count. The doctors had just said, we'll just keep doing treatment. It's fine. Something that's really important for people to understand is that, again, if your doctor is an IVF doctor thinking that I just need 1 sperm to fertilize 1 egg, they may have a different mindset about what normal is, because in his view of the world, normal is you just have any sperm, as opposed to you being able to conceive naturally. This is why it comes back to that whole conversation that we were having before about understanding your ideal ranges, as opposed to just what is normal, what's not normal. And so anyway, by the time we had this conversation, he was very shocked that he had a low sperm count. And I said, okay, let's get testing, let's get treating and figuring out what's going on. We did what we normally do, which is we start with really understanding the case and really understanding what's missing in terms of investigations. We went and we started to investigate more. We understood that there were lots of metabolic issues. In fact, she was diabetic. There were insulin resistance issues for him. There was DNA fragmentation. But this was the part that nobody was expecting.
Wow.
They both had chlamydia that had not been picked up or treated for God knows how many years. And we basically obviously went through and we did all of the other testing that we needed. We obviously got them onto a long course of antibiotics. It took a couple of courses of antibiotics to actually clear it. We retested. It was clear. We then went, okay, let's do more of this kind of cleanup. They lost 15 kilos each. It was really, there was a kind of a metabolic transformation as well as just a whole full biological kind of revamp. And then they conceived. Try after all of that was done naturally with her own eggs. And they now have a beautiful boy who's a little baby genius. But the reality is that when people are told that there's nothing they can do, it's usually because the clinician that's treating them has reached their level of understanding of, one, what's possible, and two, how to actually change those outcomes, you see, because most people go to an IVF doctor expecting that they're going to improve them. Don't make that mistake. An IVF doctor's job is to run an IVF cycle and have you survive the other side of that, because it's a full surgical procedure. You're stimulating with drugs. If you have overstimulation, it can be essentially lethal for a woman. And ultimately, that process is not without its risk, and it's not that it shouldn't be there, but the reality of it is that it actually got brought into commercialization for helping women who had blocked fallopian tubes have babies. That was the entire purpose of the whole IVF procedure. It wasn't how it's used today, which is ultimately for every possible issue that is affecting sperm, is affecting eggs, is affecting a couple. IVF these days is used for everything, including things that it shouldn't be used for. Because, for example, if a couple gets pregnant and is not able to keep a pregnancy to term, either because they have chemical pregnancies or miscarriages, whatever it may be, usually it's not because they can't make an embryo, and it's not because they're not making embryos within themselves. It's actually because there might be other factors, immunological components, silent infections, other issues that are actually playing a role and stopping the outcome that you want to see from being seen, from happening. That's why it's important to take a step back when you've had multiple cycles that haven't worked, or years of it not working, or have had multiple miscarriages that keep happening. You have to stop and question, because doing more of the same, more treatment without understanding that you don't have a leaking toilet problem, you have a shower proofing issue, is not going to deliver the outcome that you want. You're still going to have a problem. I think that, again, it's about understanding those things. When people ask, okay,
what can they do?
So what can I do to change this? Absolutely. The first thing that I say is,
I like that.
Act pregnant now to get pregnant. And that applies to both partners, you see? Because the reality is this: if you are carrying, which every single person is, carrying 50% of that little baby that you want to create inside you now, in the form of sperm, in the form of eggs, what is your job? Your job is to nurture that fertility potential as much as you possibly can, so that you can end up with the situation, the outcome that you actually want, as opposed to essentially not understanding how you're going to go about whatever it is that's going on. Is going to be the most important thing. First of all, the things that we talked about before, that absolutely every single thing that you would start doing or stop doing if you wanted to have the healthiest possible baby, you need to start doing and stop doing now. That's ultimately the thing that you want to do. And that's going to be stop drinking, stop smoking, stop doing drugs, go to bed early, exercise, eat well. You know, all of those things that we take for granted as areas of improvement, they really begin to matter a lot. And then, of course, what we also want to do is educate ourselves on what other exposures are in our day to day, because a lot of men have a lot of occupational exposures that affect them that they don't even realize for the most part. Or if they realize, oh my God, I'm seeing across the road from my office, there is a building being demolished. I'm seeing these guys because they have to rip, because there's lots of construction, other buildings around it. They have to manually gutter the place to then start to break it down. And I see these guys, literally, this is probably 100-year-old building. And they have bits of ceiling and walls and all of these things. And there is asbestos in this building, right? And I'm literally seeing these guys, no gloves, no masks, no goggles, literally taking this stuff and throwing it. When they throw it from the top floor to the bottom floor into the whatever that thing is called that captures it to take it away, the container to take it away. Literally, I see this, I don't know, it looked Hiroshima, this cloud of God knows what. And here are these guys breathing it on their skin, in their eyes, in their mucous membranes. It's just absolutely insane how little people consider their health at work, and occupational environments and occupational toxins make a huge, huge difference to your health in the long term. So it will not surprise me the number of health conditions that these workers are going to have and develop by seeing how they actually are operating now. And now, yes, they might be in their 20s and young and healthy and think they're invincible, but a decade will pass pretty quickly and you start seeing the negative impacts of that. The key is to understand fertility is a team sport. That is the first and number one most important thing that couples need to understand and work on together to optimize their chances of taking home a healthy baby, especially when things haven't been easy and straightforward. Because if it's easy, nobody's going to even be listening to this at this point. But the people who actually struggle, ultimately, they are going to understand that, yes, there is more you can do. And I can tell you that because I've been doing this work now for 25 years. This is not the first time that I have seen a couple with 14 years of infertility conceive naturally. It's happened many, many, literally thousands of times before. And it's about really identifying what are the issues, and you clean up literally a world of problems by acting pregnant now to get pregnant later. You really do. And then you're refining, you're fine-tuning, you're understanding, you're going in for proper diagnosis, proper testing, proper interpretation of results. That then starts to build a picture that enables us to act and change clinical outcomes. That's how people need to think, is that if you have been told that you've done everything and nothing has worked, or if you feel that you've done everything and nothing has worked, that is not true. That's the first step to understand. That is never, ever, ever true. If it were true, I wouldn't have 78.8% live birth rate for the patients in my program. It's really a matter of identifying the problem and addressing it effectively.
You said earlier, when doctors don't want to test, or they give you a test and it's a selective test and they're not looking at everything, or in the frustrating world, whether fertility or not, it's just doctor not being maybe up and aware with the science or addressing any metabolic or outside lifestyle changes. And for people, it's unfortunately the world we live in when it comes to chemicals and all this stuff, it's not changing. It's only getting worse. And to educate people on being the best we can. I know I tell people I'm neurotic, but I limit all my plastic use, and I don't put chemicals on my skin that I know is bad. And if that's the world that it
Yeah.
takes to be healthy, for me, it makes me okay. But I want other people to know the same, even if you're in your 20s. I have a coworker, heats up plastic every day, and it drives me nuts. Dude, this could be dropping your testosterone. And for multiple things, not even just fertility, but overall just strength and health. And I'll
Yeah.
tell to him, it's just still, it doesn't register. The point being is I don't want people, and sure you don't want people to be too late when they get into their 30 or whenever they try to have kids. And all of a sudden now they're going, well, what the heck did I do 4 years ago, 5 years ago? What am I doing now that's not helping? At the same time, you said you go to you, it's reversible. You can change it by taking charge of your life. And that's what you have. And when you go to your website and you have the F.E.R.T.I.L.E method, that's your method. You've trademarked it. What can people else find on your website, your services? How do you help them?
There are lots of different ways. I always recommend people do my free fertility challenge first, because that's going to give them a really wonderful global picture of what it is that they need to address and how they need to look at their fertility differently. Because, the point here isn't giving doctors a bad rap. They do the best that they can. The issue is that their scope is limited to their area of specialty. And when couples are struggling to conceive, they usually need a combination of skills and skill sets that they're not going to find in any kind of one specialty of medicine. And so it's about really understanding that. And that's really how we are very different. We're looking at multiple areas of specialty and coordinating treatment and identifying issues across an entire human, as opposed to a body part or a system that essentially a specialty works under. We actually integrate and work with all of those things at the same time. Doing the fertility challenge, I think, is a great thing. And then the first step, when people are interested in considering what it is that we do specifically in terms of treatment, we have an assessment process. That's the first step. They need to have a complimentary, well, it actually used to be complimentary. It's no longer complimentary with me. They have to pay now for this assessment. But basically, what ends up happening is we do have a process that they can have a complimentary conversation with one of my team to figure out if it's for them. And then basically what ends up happening from there is that we go through and really analyze, based on the F.E.R.T.I.L.E method and the framework that we operate, where are the gaps? We're benchmarking their particular case against what it is that I actually see and how it is that we would approach the case. We're then looking for the gaps, the places of opportunity, the missing things, the things that haven't been done, the things that have been overlooked or even misinterpreted. Like I said before, when somebody comes and brings me an insulin of 20 and they're told everything is normal with their fasting glucose, oh my God, where do I begin? And really understanding that nuance and helping the patient to understand where they stand before we even jump into treatment. That's the first step. And if from there they decide that they want more, then there are different avenues that we can take them, the Fertility Breakthrough Program being one of them. But it's really about first understanding, because sometimes there are also people that I can't help. Sometimes people come to me and they will say things, I have 2 blocked fallopian tubes and I will never do IVF. Or I'm menopausal and I will never do donor egg. Or I have no sperm and I would never, because I have some genetic mutation, and I will never do donor sperm. To those cases, I have to say I'm good, but I'm not that good. Immaculate conception has not been a part of my training. And that is where I kind of have to be really open and honest and say, hey, listen, I can't help you. And if there are instances where people are in situations that they just want a second opinion and they just want to know, am I on the path? It might not be for us to take over their treatment at that particular point. I will always be extremely transparent, because for me at this stage in my career and having been doing this for such a long time, what we're focused on is demonstrating clinical effectiveness, because really what I want is in the next 20 to 30 years, have this be much more mainstream in terms of what people get to access before they're offered IVF. You see, because we know the power of optimization in terms of health. And it's time that the healthcare system integrates that approach in a much, much more cohesive and better way for patients who are not the same as the general population that just,
and these conversations, this one need to be had more and more accepted. I mean, I think a lot of people shy away from that conversation, and I think that's a bad thing. And for what I do as a coach, and even on this, I'm always, hey, I want to talk about the stuff people don't want to talk about, because there's always an opportunity, you said, to educate people. That's the biggest thing, is how do we educate and keep pushing
100%.
people that might not nerd out we do into this, but how do we help them understand that they can take control of their life and really own their life and get what they want out of it, if they're willing to change their lifestyle and really to live a better life.
And there is much of that that's possible if you apply yourself in everything. I mean, if you want to build muscle, you can't go to the gym once and expect that Arnold Schwarzenegger in the next 6 months. I wish that was true. I really do. My hip thrusts are, my PB is 221 kilos, over 400 pounds for 5. And I tell you, if that works, I would already have the full physique that I'm looking for. Unfortunately, no, it does not do it. It requires a whole lot more consistency and hard work and all of that. And if you've ever worked to build muscle, build fertility is actually pretty simple. You have what it takes to optimize and to really look at things from a different perspective. One thing that I think is worth flagging is the use of anabolic steroids and testosterone and all of those things when it comes to fertility, because I think that a lot of times people don't realize that they can have quite permanent negative effects on fertility outcomes. And so if you are considering and not doing any of those things, don't do it if you want to have a family in the future. And if you are doing it, then my recommendation to you is that you wean off and really start to look at your fertility status years before you actually want to start trying for a family, because having patients who are bodybuilders and who essentially have taken certain substances throughout their career, it's harder work than you might think to reverse those effects. And don't start is the first, if you can. And second, really plan ahead
absolutely
with
that
years
might have to be
in
a
advance,
part 2 of the episode if you have time. Where can people find you? Because I know we're running up the hour, and for people who don't know, she's in Australia. She's on the other side of the world now, getting it in at 7 a.m. I know she's got probably a busy day, which is awesome.
Absolutely. People can find me on Instagram, Gabriela Rosa Fertility, and it's Gabriela with 1 L, GABRIELA ROSA. If you Google my name, you will find me somewhere. And of course, our website is fertilitybreakthrough.com. People can go there as well. And one thing that's worth noting is my book, Fertility Breakthrough, Overcoming Infertility and Recurrent Miscarriage When Other Treatments Have Failed, is free on Spotify and YouTube. So the audio version, people can get onto that and listen to it. And of course, it's available on Amazon and any bookseller. But it's a good read as well from that perspective. But I would recommend Googling Gabriela Rosa Fertility Challenge. And
Matt Gluckman and Eric Mencher here from Think Fitness Life. Our entire careers have been dedicated to fitness, particularly how the mind helps the body. We've been around gyms and nutrition strategies for 25 plus years collectively, and nothing harms or helps better than your own mind, untrained or trained. Pushing beyond your limits, overcoming whatever's thrown your way, and making the decision to show up day in and day out as a lifestyle takes more soul than sand. And what I mean by that is when you can get your mindset and heart leading you consistently in the direction of your goals and dreams, well, it's just a matter of time before you have the performance, physique, or quality of life you're yearning for. See, your thoughts will stem from your beliefs, which will then lead you to action, which develop into your behavior and ultimately lead you to results. It's really that simple. Our process takes time and it takes open communication. It's amazing what pops up along the fitness journey to betterment, and we can be there every step of the way. To learn more or apply for coaching, visit www.thinkfitnesslife.com. Start recreating your life today.
Support through telehealth, but it feels overwhelming and rushed? Check out orderlymeds.com now. Orderlymeds.com was built to be different. Here, you connect with real doctors who take the time to understand your goals, review your eligibility, and guide you through a plan that's right for you. Orderly Meds provides access to proven GLP-1 medications like semaglutide and tirzepatide, including both name brand options and personalized compound versions when appropriate. So you have choices backed by clinical oversight, not guesswork. It's a simpler, more supportive telehealth experience designed around people who want clarity, care, and confidence in their weight loss journey. And your medication is delivered directly to your home in discreet packaging, so your experience stays private from start to finish. Do your research, ask the right questions, then visit orderlymeds.com/podcast for an exclusive offer. Again, that's orderlymeds.com/podcast. Individual results may vary, not medical advice. Eligibility required. See site for details.